Good morning everyone. I am Dr. Chandra Reddy, first year PG Community Medicine. Today we are going to discuss about the primary health care. Primary health care consists of uh, village level health workers and sub-center and also primary health care. At village level, we have ASHA scheme, ICDS scheme and training of local DAS to manage the normal deliveries. So ASHA worker should be a resident of village. She is a woman between 25 to 45 years. A ASHA worker should present one ASHA worker per 1000 population. In rural or tribal desert areas, one ASHA worker for one habitation. And ASHA workers' responsibilities are create awareness and provide information regarding the health related issues and all other concerns of the village people. Counsel the women regarding birth preparedness, importance on safe delivery, breastfeeding, immunization of the pregnant women, contraception to avoid pregnancies, prevention of sexually transmitted diseases, and to take care of the young child. Mobilize the community to take care health whenever the health care is required, and work with village sanitation committee. She will give some guidance to how to maintain sanitation. Arrange escort to pregnant women, children requiring treatment at PSC or CSC. Whenever pregnant women become sick or some other issues related to pregnancy, and whenever children sick and there is no support for them, she will arrange the escort to take care of them and to guide them to go to the PSC and CSC, which are higher centers. This ASHA worker also act as a depot holder. So she contains oral rehydration solution, ORS, iron and folic acid tablets, chloroquine, oral pills, and condoms. Whenever the village people require these, she will give them. And she also act as a DOTS observer, which is the process in TB treatment. ICDS scheme. In this, there are Anganwadi worker who will be the present for about one Anganwadi worker per 400 to 800 population. Angan means courtyard. So she will take care of mainly maintenance of growth charts of the children, immunization, and she will provide supplementary nutrition to the children and pregnant women. She will give health education and non-formal preschool education and referral services. Presently, there are about 100 such workers in each ICDS project, and all over India, there are 7,067 ICDS blocks. So another thing we do at village level is training of local DAS. Scheme was initiated in 2001-02, aim to train at least one DAI in every village with the objective of making delivery safe. Okay. So next, after village, we have sub-center, where one sub-center should be according to current guidelines for 5,000 population, we should have one sub-center, and at tribal, backward areas or hilly areas, we should have one sub-center per 3,000 population. There are two types of sub-centers. Type A, where we will not get any delivery services. For type B, there are all services include delivery. Okay. And services provided at sub-center levels are maternal and child health, family planning and contraception, water quality monitoring and promotion of sanitation, disease surveillance, integrated disease surveillance project, national health programs, and record vital events like births and deaths. Next level is primary health center level. For each 30,000 population, we should have one primary health center according to current guidelines. And in hilly, tribal and backward areas, we should have one primary health center for 20,000 population. There are two types of PSCs, type A with less than 20 deliveries per month, type B with 20 or more deliveries per month. And in primary health center, there are at sub center actually taken care by the healthcare workers, but at primary health center, there are one doctor who is we'll call it as a medical officer available at primary health center, and services available at PSC are medical care, mainly outpatient department. It is about 4 hours in the morning, 2 hours evening or afternoon, and a doctor should see minimum 40 patients per doctor. And at PSC, we should get 24 hours emergency services, like whenever injuries occurs, whenever patient are not good, and there may be some other problems like low BP and other emergency cases. They should stabilize the patient before referring to the higher center. For example, in dog bite, you should wash the wound and with plenty of water and soap. In case of snake bite, we should give ASV, and we should wash, and we should give some antibiotic injections and other tetanus immunization. In scorpion bites, we should take care of the pain. In scorpion bite, the patient main complaint is pain at the biting side. So we should give some xylocaine, or and we should give some other painkillers. And after stabilizing a patient, we at PSC level we should refer to the higher center. At PSC also we have some basic inpatient services like taking care of the diarrhea, stabilization of the patient by giving some fluids. Some other inpatient services also should available at PSC. And another thing available at PSC are maternal and child health care. This is a very important service available at PSC. In antenatal, there should be early registration and minimum 4 checkups. The early registration we will do it by helping of the Anganwadi workers, ASHA workers, and other healthcare workers. At least one antenatal checkup should be preferably by third, seen by a doctor, and lab investigation should also available at PSC for antenatal women, which is hemoglobin checkup, blood grouping and RH typing, urine albumin and sugar, RPR test for syphilis. If there is some low hemoglobin, we can prescribe them iron and folic acid. If blood grouping is negative, negative typing is there, then we can ask our husband's blood group, and then according to we can refer to the patients to higher center whenever, why, because some rare RH negative blood group is very rare, and there may be some reactions if woman is RH negative and husband is RH positive. There are some fetal issues also present with that grouping of the RH negative grouping, so that we can initially counsel the pregnant women what are the future complications occur with the RH negative grouping. Okay, and we should at primary health center we should also give counseling regarding the nutrition and health, and giving supplementation of folic acid. Folic acid we should give it mainly in first trimester, and iron and folic acid after second trimester. And also we should give earlier there was only TT immunization for the pregnant women. Now the recommendation is DT immunization, 2 injections in pregnant women. We should give it primary health center. And we should also identify the high risk pregnancies, so that we can refer the patient whenever there is some risks to the pregnant woman. And in intranatal, at PSC level, we should get 24-hour service for normal delivery, promotion of institutional delivery, conducting assisted deliveries, example forceps and vacuum, manual removal of the placenta whenever the placenta will not come spontaneously, appropriate and prompt referral whenever there is some, if we are unable to control postpartum hemorrhage, or else patient is complaining of some other issues like eclampsia, and other services management of we should also manage some extent pregnancy induced hypertension, and we should identify postpartum hemorrhage, eclampsia and sepsis, so that we can refer to the patient to the highest center. And postnatal services available at primary health level are ensure postnatal care, and for 0 and 3rd day we should visit the pregnant women at village level by a medical officer, and other extra Visits by the ANMs at 17th, 42nd day and third additional visits for low birth weight babies and 14th, 21st and 20th day. Initiation of early breastfeeding should be encouraged. Counseling on nutrition, hygiene, contraception, essential newborn care. And newborn care should include initiation of early breastfeeding, management of neonatal hypothermia, which we call it as kangaroo mother care, where a infant should be always in such a position that which is we call it as a kangaroo mother care, and other issues regarding newborn care as cord care. In villages, we regularly see that they apply some cow dung and other issues. So we should give the counseling regarding that and maintain the aseptic precautions to take care of the cord care and to take care prevention of the infection, identification of sick newborns. So how we will identify the sick newborns? Are they, if newborn is not taking breastfeeding and not responding and unconscious or not responding to the painful stimuli, all these are the danger signs that which we will identify the newborn with danger signs. Then we will refer to the higher center. Care of the child. Emergency care of sick child, including integrated management of neonatal and childhood illness, promotion of breastfeeding for 6 months, full immunization of all infants and children against vaccine preventable diseases, and we should also give vitamin A prophylaxis, assess the growth, so that we will initially identify the growth retarded children or low birth weight children. If they are not catching their weight according to their age, then so that we can give some nutritional supplementation, or else we can refer to the higher center. Management of severe acute malnutrition cases also available at PSC level. Other services available at PSCs are family planning, including copper T and tubectomy, vasectomy, MTP, prevention and management of sexually transmitted diseases. In schools, health services mainly include checking the regular physical examination to identify any anemia and other disabilities and any other issues like malnutrition, so that we can give some nutritional supplementation. And this at PSC level, we should also give adolescent health care, where adolescent issues like we should educate the children regarding the menstruation issues and other sexual related issues, and prevention and control of the locally endemic diseases like malaria, kalas, or Japanese encephalitis, collection and reporting of vital events like births and deaths, health education, promotion of sanitation, and testing of water are also available at primary health center level. So various national health programs also taken care by this primary health care system, including PSC and sub-center and village level. So presently available main important national available programs are revised national tuberculosis control program, where we should test the patients with chronic cough by taking their sputum for the smear examination. If they found positive, then we will also start anti-tubercular treatment, and we will, there are some dots program where we at primary health care center level they will provide the drugs and we will hand over to the patients to taken care by the health workers. National vector borne disease control program, national AIDS control program, and giving counseling to the patients who are positive. A national program for control of blindness by checking the acute I mean refractiveness of the people, and also we can check for whether there is a cataracts, so that we can refer to the patients to IS centers to cataract surgeries and giving some vitamin A supplementation. National programs for prevention and control of deafness. We shall initially we should try to identify the impairment of hearing and permanent deafness, so that we can refer the patients to IS centers to correct their impairment and deafness. National mental health programs to identify early the to identify this depression or else schizophrenia at an early stage, so that we can refer to the patients to higher center. And at PSC level also we can give some counseling for the minor ailments. National program for prevention and control of cancer, diabetes and stroke. So we can find the danger signs of the cancers like any chronic non-healing ulcers in the mouth, or else lumps or thickness of the breast and other danger signs, so that we can identify them early, and so that we can refer to the higher centers. By by doing screening for the diabetes, we can identify the diabetic patients, so that we can treat at the PSC level. Other services of PSCs are appropriate and prompt referral, record of vital events like births and deaths, training of the ASHA workers and other health workers, and DIAS, basic laboratory services like hemoglobin, albumin levels, and typhoid testing, malaria testing. All tests we can do it PSC levels, and monitoring and supervision. Selectical surgical procedure also we will do it PSCs like vasectomy, tubectomy, medical termination of pregnancy, hydrocelectomy, and cataract surgery also we can do it PSCs, and monitoring and supervision of the other like programs of the national health programs. Thank you.